Hi, I'm Dr. Clea Anagnostopoulou and one of the doctors here at Clinic 66, and today I'm just going to talk to you a little bit about breast health and touch on a little bit on breast cancer as well. So our breasts change and vary throughout our sexual and reproductive life. As women, we transition from puberty to pregnancy to breastfeeding to menopause and postmenopause, and our breasts will change accordingly at that time as well. So when we talk about breast feeling normal, we know that we feel lots of different structures in the breast. Things like lymph glands and fatty tissue and milk glands and lots of nerve cells that make our breasts very tender. And also it's important to remember that breasts will change in size and shape as we go through our sexual reproductive life, and that the fact that most breasts are not always symmetrical, so it is important to remember that. So breast tissue is composed of lots of different cells, specifically fatty tissue, lymph glands, milk ducts, nerves and arteries and veins that make our breasts quite tender. It's not unusual for breasts to also feel different throughout the menstrual cycle, especially if you are menstruating. So women will always notice that the breasts are a bit more tender and lumpy just before a menstrual cycle, and feel a lot more comfortable after the menstrual cycle. Not all breast pain also can originate also from the breast tissue itself. For example, if you're overexerting yourself and have strained a little bit of your pectoralis muscle, which sits under the breast, that can also radiate to the breast tissue and make it feel like it's originating from the breast. Usually that kind of pain is usually resolved with just some rest or some non-steroidal anti-inflammatory drugs like ibuprofen. So it's really important as women that we examine our breasts regularly and get to know the normal look and feel of our breasts. Breast tissue does change throughout the menstrual cycle, so it is important to do it preferably after the period, where our breasts are more quiet, less lumpy, less tender. It is important to also do it at a time where you feel comfortable, so maybe in the shower or in bed. You can be standing or sitting, it doesn't matter. And as soon as you feel something that wasn't there before or is new, it is important that you see your GP and get that looked at as soon as possible. So BreastScreen is a government-funded national program that offers free breast screening to women between the ages of 50 and 74. Women between the ages of 40 and 49 and 75 and above can also attend BreastScreen. It is for screening only, so not geared for women who have detected a lump or an abnormality in their breast. In that situation, you should be seeing your GP and get that adequately followed up in a specialist clinic. The examination itself normally involves 2 x-rays of each breast. The amount of x-ray radiation is usually less than that of a chest x-ray, so very minimal. And the test itself normally takes just a few seconds. So it's just a few seconds of discomfort that most women feel. It takes approximately 20 minutes, conducted by specialist radiographers, which are all female, and it is a really important tool for women to keep aware about what's happening in their breasts on a regular basis. And it's usually conducted every 2 years. Roughly 9 out of 10 women who attend BreastScreen do receive a normal result. That means less than 1 in 10 women will have something found in their breast. The important thing about that is that BreastScreen will send you a special letter to attend a special assessment clinic. At the assessment clinic at BreastScreen, you will be able to be examined by a breast physician. You will have both a breast ultrasound and potentially biopsy conducted, and the majority of women will be reassured. Over 90% of women will be reassured. If something is picked up at BreastScreen, then you will be appropriately referred to specialists for ongoing care. It is really important that you attend to see your doctor at any time that you find something abnormal in your breast. It is important that if you notice any lumpiness, especially in one breast, Any changes in the colour or shape of the breast, again, especially in one breast. Any changes to the nipple, specifically any indrawing of the nipple or any crustiness or any nipple discharge, again, especially if it's in one breast. Any changes in pain or discomfort to your breast should be always identified by your GP. And certainly any time that you've noticed a change when normally you would not have noticed that. So that's why it's important to get to know the size and shape and feel of your own breast, so you'll be able to identify changes early. The most common risk factors for breast cancer are being female and being over the age of 50, because we know that most breast cancers are diagnosed over that particular age. As I mentioned before, it is important to have breast symptoms investigated at any age, but we do know that women over the age of 50 are at a slightly higher risk. Women are 100 times more at risk of breast cancer than men. Also, the other important risk factors involve having more lumpy or dense breasts, purely because it is more difficult to detect breast cancer sometimes in these women. Family history, a very strong family history of breast cancer can also be indicative of higher risk, and those women are usually the women who have 2 or more first-degree relatives of breast cancer. It is important to understand, though, that 9 out of 10 women who do develop breast cancer do not have a family history. We also talk about women who drink alcohol, because that increases your risk of breast cancer due to the fact that the liver is not able to process the estrogen as effectively. So high intake of alcohol can be a high risk of breast cancer as well. And also women who are overweight or above a certain BMI or healthy weight, above a healthy weight, are also at a higher risk of breast cancer. So the current mammogram guidelines are for women to be screened every 2 years between the ages of 50 and 74. Women who are between the ages of 40 and 49 and women who are over the age of 75 can also attend BreastScreen for a screening mammogram every 2 years. So trans and gender diverse people have a very unique set of factors that can influence their risk of breast cancer. In general, if you are taking gender-affirming hormones, specifically estrogen, for more than 5 years, it is very important that you still attend for breast checks and breast screening. If you have had surgery, specifically chest surgery, and have had breast tissue removed, then breast screening is not really necessary and it's not very possible. Women with breast implants can certainly attend BreastScreen. It is important to do so. The only difference is that women with breast implants such as silicone or saline-based implants may need some extra views, because it's very difficult sometimes for the radiation to break through the breast implants and into the breast tissue, the surrounding breast tissue. So the specialist radiographers there will be able to take some additional views and have expertise in moderating the amount of compression on the implant to minimize any damage. It is important that you do tell your radiographer that you do have implants, so they can take that extra care. And it is important that women with implants attend for BreastScreen, specifically because it is that little bit more difficult to detect changes in your own breasts. Women can be breast aware via 3 different ways. First of all, get to know the look and feel of your own breasts. It's very, very important. You'll be the first person usually to detect any changes. And the best way to do that is to check your breasts on a regular basis. So specifically, if you're still menstruating, it is important that you're checking your breasts after a period. And if you're not menstruating, then it is important just to allocate a day a month specifically to check your breasts. Secondly is to attend and see your GP if you do detect any changes to your breasts. And finally and thirdly, it is so important that you do attend the normal breast screening that you should be assigned to, specifically every 2 years between the ages of 50 and 74. And that is an amazing resource available to us for women who don't detect any particular lumps, but particularly are there to find any lumps that are difficult to detect through the screening program. First of all, it is important to maintain a healthy weight. so that it is easier to feel breast tissue through women who are not overweight. It is important to maintain a good healthy diet. It is important to exercise. Exercise has been proven to reduce the risk of breast cancer, especially in women with a previous history of breast cancer. It is important also that you attend BreastScreen, so that way you are monitored on a regular basis. In between screening though, it is important that you do check your breasts on a regular basis as well, because screening is normally every 2 years and we don't want women to slip through the cracks in that time. And certainly if you do find any unusual lumps, you get those looked at immediately by your GP.